Welcome to the Fear and Greed Daily Interview. I'm Sean Aylmer. There's been a real focus on health over the past couple of years. The pandemic has made many of us take stock of how healthy we are or not, and what we need to do to improve our well-being. But at the same time, lockdowns, the risk of COVID and elective surgery cancellations meant a lot of people didn't access the medical treatment they otherwise would have sought. Damien Mu is the CEO and Managing Director of health insurer AIA Australia. Damien, welcome to Fear and Greed.
Hey, Sean. Yeah, thanks for having me. Good to be here.
My first question, it's a little bit obvious, but I don't know the answer. What exactly is health? How do you define it?
Well, that's a great question, Sean. I think there's many interpretations and definitions out there, but the way we describe health is both your physical and mental well-being and how you can optimize that best for yourself.
So, Damien, what exactly is well-being? I suppose when I think of well-being, I think more about mental health, although I suppose it is part physical as well. How do we think about well-being?
Yeah, I think it's a great question, and I think everyone's trying to come up with a really common definition and interpretation. But from our perspective, it is the combination of both the physical and mental well-being. And we've seen that through our studies. We conducted the largest global study into mental health with Quantium with about 1.5 billion bits of health data. And what you saw was, where people took an average of 7,500 steps a day versus those that took an average of 2,500. Those that took an average of 2,500 were 4 to 5 times more likely to have a mental health issue. And so, physical and mental aspects go together to create that overall well-being. And we know, of course, for example, if you get more sleep, you're more likely to feel good and then maybe go for a walk or a run. So they're definitely interrelated and we need to focus on both.
Okay, so sleep is an example of something that people should do to improve their overall well-being. What other aspects should people be thinking about to improve their well-being?
Yeah, look, we think about it as small steps. So it's not about anything dramatic. It's just small improvements in controllable lifestyle factors around physical inactivity, nutrition, obviously stop smoking, reducing excess alcohol, sugar, and interaction with the environment. And, we think those are really important things where people can make small improvements in their overall daily life.
Okay, now AIA has applied behavioural economic principles to keep its members engaged with fitness, health and well-being, the AIA Vitality digital program. Can you tell us a little bit about that?
Yeah, absolutely. Vitality is the world-leading health and wellbeing program globally with around 11 million people on the program, and it's been in existence for over nearly 30 years now. And really, it's a behavioural economics model that recognises that there's 3 elements that need to come together. You need to know your health, so that's about education and knowledge, and then you need to improve it. But to keep going and keep people on the journey, you need to reward your health and incentivize yourself. So the know your health is really important. We've had over 1.5 million of our members do their health assessment online. 50% of those went on to do their mental wellbeing assessment. And then we provide free health checks through the chemist partners we have around the country so that people can really get a good knowledge base and receive lots of points for that so they can improve their overall status, which unlocks discounts on their premiums, but also greater rewards. But we know once someone has knowledge and a plan, there are barriers that we need to remove. So the Improve Your Health part is really about giving people access to the elements that will help them improve their health. So whether it's personal training, whether it's quit smoking programs or nutrition access, or 50% off their gym membership to reduce the cost. We provide members 50% off their Fitness First and their Virgin memberships, Good Life, or whether it's access to devices, cheaper devices. For example, you can earn your Apple Watch free through Vitality. And not everyone goes to the gym, and especially in Australia, people like to train outdoors. So they can earn their Apple Watch free by just doing their activity. Once, though, they actually start that journey, what's really important, Sean, is, a lot of people start going to the gym or start taking a walk or start something healthy in their nutrition. To keep them going, we have the incentives and rewards. So they get their weekly active benefit rewards for getting their points for their sleep or nutrition or activity. And they're smaller rewards at any of our partners. And then there's the bigger ones where they could get 50% off, their flights with Virgin or 40% off their Endota treatments. And, we've seen over $3.5 million of Endota treatments redeemed by Vitality members for their getting rewarded for their health. So it's great to see, and over, $12 million of shopping rewards in the last 2 years.
So is this an age thing? Do you have more 50-year-olds than 20-year-olds?
So that's a great question, because what we saw was, we thought there'd be a natural skewing to the younger ages given the program, but actually it goes right across the age demographic. But interestingly, Sean, when we introduced the Apple Watch benefit, what we saw was an overall 35% of improvement for members' activity from before they had the Apple Watch to after that. So it goes to show once they had the Apple Watch and they could track their data and have it easily accessible, it encouraged them to improve their activity by 35%. Now, in the ages of 50 and above, that improved by 50%. So it's really...
Okay, Damien, you have to be very careful here, right? Because you are talking about me who got an Apple Watch for Christmas in that age group. It just keeps buzzing at me. It makes me do stuff. I just want to sit and relax. Won't allow me.
Well, Sean, I mean, that's about, making sure that we're not letting it control us, but it's given us those gentle nudges. And, people, I think it really highlights to financial services and insurers, people want to be healthier, and it's really about coupling the proposition with a great user experience. And of course, Apple are the best at it, right? In terms of making things easy. So by partnering together with Apple, we're able to give them access to a world-leading science-backed program, but enable it easily through a user experience that it's there when they need it. But yes, you do want to tell the Apple Watch to be quiet sometimes.
Sometimes. Stay with me, Damien, and we'll be back in a minute. My guest this morning is Damien Mu, CEO and Managing Director of health insurer AIA Australia. So all of this, of course, makes sense for individuals and financial sense for individuals to be healthy, both physically and mentally, but it also makes financial sense, presumably, to health insurers such as AIA, because the people pay premiums, but the healthier they are, the better off for the bottom line for you, AIA.
Yeah, absolutely. And this is a shared value program, right? So what we identify is, and what shared value is to us, is how does what we do as a business intersect to help solve a societal issue? And one of the issues in Australia and around the globe, but focusing in Australia, is the growing incidence of health issues. So if you look at the trends, diabetes doubled to 2008 and then doubled again to 2018. Mental health, 1 in 2 Australians will have a mental health issue in their life, 1 in 4 every year. So that's not going the way we want. But our 5590 report showed that there are 5 controllable lifestyle factors that I mentioned earlier: physical inactivity, poor nutrition, smoking, excess alcohol, and our interaction with the environment, that will lead to 5 of the chronic diseases that are responsible for 90% of deaths in Australia. So that's cancer, diabetes, respiratory disease, heart disease, and mental health. Now, that's a message for hope for us, Sean, because it's 63% worldwide, but 90% in Australia. And what that's saying is that we're quite blessed, right? Because we've got clean air, good water, great healthcare system, access to good quality foods, and education. So you couple that, and it's really, it's more lifestyle behaviors as opposed to, access to vaccinations, access to clean water in some parts of the world. So if we can help people to make those small steps, we can deliver our dream at AIA, which is to help Australia to be the healthiest nation in the world. But to your point specifically, Sean, so by helping to solve this issue, what we hope to be able to do is, by providing the Vitality program, we can provide our members a discount to their premiums straight up, because we know that they're more likely to be healthier, less claims, and stay longer. So the retention of our customers is longer as well. And what we do through those improved outcomes is fund, as I mentioned, that program where we can fund 50% of the gym membership, give you free health checks across the country, create all our content for you to get access to the tips you need. And of course, as I mentioned, make sure we're providing a discount to the premiums. So it is a shared value system that, win-win-win, right? Win for customer, win for society, because it reduces the strain on the healthcare system and economy, and a win for AIA, hopefully, as well.
Okay, so what about the pandemic? How has that changed how people think about their health? And with lots of anecdotes, at least, of mental health challenges increasing during the pandemic. Was that the case? Well, what did you see?
What we saw, Sean, was actually absolute focus, as you'd imagine, when there's a pandemic, for people to put a spotlight on their own health, which is a great thing, right? Because otherwise life can get pretty busy and overwhelming, and it becomes something we'll do tomorrow, right? Put it off for tomorrow, and tomorrow really never comes on that focus. But this shone a light on our health and well-being. And what we saw early on, Sean, was when we did the survey with people, is initially the levels of anxiety and stress had increased dramatically. Anxiety for those, and it was different for everyone. Anxiety for those that were feeling isolated because they were living on their own and in the lockdown. And then there was the anxiety that came with homeschooling and trying to work from home and being stuck with the family. And the levels of stress also increased. What we did, though, see around some of the other things was that quickly changed to people engaging with different services from their health and life insurance, like AIA who had it, which was, our content around AIA Wellbeing Toolkit, where people could Zoom in and work out with one of our ambassadors or do a meditation with one of our ambassadors, do some healthy cooking and eating. And actually one of the stats was we saw people's diet improve because they were eating less takeaway and cooking more meals at home. And then the big silver lining was actually people starting to get out and be amongst nature and actually walk with their family, go for a ride with their kids and do the little things we were allowed to within the regulations. So it was an interesting one, but there's a latent issue there, Sean, that we should never be complacent about. The mental health, there was a visible increase in the number of people accessing services around their mental health. And the good thing is they were accessing those. But we hope there isn't a latent increase in incidents, but that is likely after such a long pandemic, especially those in Victoria and others. And finally, the other one is people clearly didn't get to access a number of the services that they would normally do around their preventive health. So, we all flipped to digital and telehealth and created programs to try and facilitate that. But, a number of people did put off going to the doctor, getting their screening done because of the lockdown or concerns around COVID themselves. So we hope that people will get back to normal now, but there could be a latent level of impact that comes from such a situation like a pandemic.
Severe, yeah, exactly. Damien, thank you for talking to Fear and Greed.
No problem. Thanks for having me.
That was Damien Mu, CEO and Managing Director of health insurer AIA Australia. This is the Fear and Greed Daily Interview. Join me every morning for the full Fear and Greed podcast with all the business news you need to know. I'm Sean Aylmer. Enjoy your day.